The American Heart Association's Scientific Sessions is in full swing with all the late-breaking science, cutting-edge research, and innovations you don't want to miss. And the Science and Technology Hall is now open to explore.
For more than 100 years, Novo Nordisk has been driving change. What have we learned? Helping to improve lives must go hand in hand with improving health and well-being, that people are more than their disease. That's why we have spent more than a century developing treatments to help people live lives less limited by their disease. A century of pioneering scientific breakthroughs in key areas. Today, we lead the way with transformational initiatives aimed at creating better treatments and a better world. Like you, we do it for the people who are living with, thriving with, and not being held back by disease. They are why we are investing in new, innovative medicines, why we are continuously expanding our offerings, why we are working toward an even brighter future. It's why, through the Novo Nordisk Foundation, we support scientific, humanitarian, and social programs. We are, and will always be, committed to driving change, to fight for the people living with, thriving with, not held back by disease. We call them the greats, because their disease doesn't define them. So what will? Novo Nordisk, driving change. Learn more about how Novo Nordisk continues to drive change by scanning these QR codes.
I'm Dave Huddleston, and this is AHAtv, sponsored by Novo Nordisk. We're here on the first day of AHA Scientific Sessions as thousands of researchers and professionals have come together to advance the future of cardiovascular health. Saturday in Chicago opens with a jam-packed opening session as AHA leaders share powerful messages and share their vision for heart health and set the tone for the exciting discoveries ahead.
So I'm hoping to learn more about some of the new emerging technologies and treatments for cardiac patients, and also connect with friends and colleagues around the country.
Awards were also given out, and this year's distinguished scientists were recognized. Speaking of distinguished awards, Saturday also featured the annual Nanette K. Wenger Research Goes Red Award. This year's honor goes to Dr. Sylvie Shaw and recognizes the best scientific article on cardiovascular disease and stroke in women this year.
Our research shows for the first time, to the best of our knowledge, that the risk of cardiovascular events is higher in women as compared to men who are needing dialysis, which is in contrast to what is seen in the general population, where men have been reported to have higher risk of cardiovascular events. So that really makes it interesting. That also tells us that more work needs to be done in this area.
Following the opening session, we also got our first late-breaking science sessions of the conference, including a look at AI and how it's currently being used in cardiovascular care and how the technology will transform the future. Saturday, we got another important update regarding women's health, with a session focused on the most relevant topics in cardiovascular disease affecting women and how to improve care throughout the course of their lifetime.
They talked about women and menopause, and it is scary to me to think that the impact that it does have on women, but in particular that it's not just about hormones, that there are other things that impact the risk for heart disease.
I should say, we have data to suggest that there's different treatment modalities that would affect sexes differently. So I think that is something that we could look into to try to better serve our patients.
The science of the role of inflammation in cardiovascular disease has evolved recently, creating an opportunity to increase awareness and education of systemic inflammation and its potential role in the pathogenesis of atherosclerosis, acute myocardial infarction, heart failure, and how it is specifically increased in patients who have chronic kidney disease.
With this booth, we wanted to make sure we were reaching the physicians in a way that was meaningful to them. And so the partnership between our team and the Novo Nordisk medical team was very tight.
The teams usually start a project at the very beginning of the life cycle in a fairly lo-fi way with pencil and paper, almost like a napkin sketch type of idea.
So we know where to look for most CV risk factors. Both doctors and patients are aware of them, things like cholesterol and diabetes. But other risks like systemic inflammation are less obvious, even invisible, and it's important not to overlook them. We needed to make sure that the booth was immersive and engaging, but it absolutely had to maintain scientific integrity.
Here we opted for almost like a circuitry feel to make it ownable and unique. And those kind of shapes and lines almost echo the human cardiovascular system.
It was really the spark and inspiration of BGB Group coming to us with visuals. It really just kind of came together. So from the build standpoint, this exhibit carries just about everything in terms of the latest technologies, from the magic mirrors to the reflective surfaces.
So we really want to kind of maximize that space for almost like a cinematic kind of approach to the imagery, where you have a kind of bold background and you've got very bright and vibrant graphics and typography and messaging.
So my hope is that bringing it together like this will serve as a spark to remind visitors of the applicability of the science to clinical practice.
So as you can see, this educational experience booth is the fruit of a lot of work and innovation. I welcome you to come visit us at booth 2542 to enhance your knowledge about the role of systemic inflammation in cardiovascular disease and challenge yourself by taking our quiz.
The day I had the stroke, the pain was unbearable. The fear itself was unbearable. I remember that doctors were telling me they are trying to save me, but I just couldn't avoid to think that you didn't know how to control your weight through all your life. So today you die. I didn't want to be just remembered by pictures or by anecdotes. I wanted to be a present father, an influential father, but I knew I couldn't do it alone. I have learned to ask for help, and you discover that there's much more people than you counted on. It's not about being thin, it's just about being yourself again. Because as obesity is a disease, it's not your real self. I still discover myself every day, and I'm looking forward to see what's next.
The Science and Technology Hall is a must-see here in Chicago. It's where you'll find the latest technology and the biggest names all in one place. Let's check it out.
It's an amazing experience to be here, to get to see all the research that's going on across the country. Definitely eye-opening compared to what we do on a daily basis, to see what's going on across the country and world.
I'm an interventional cardiology fellow at the Brigham, and coming to conferences like this where you have so many different fields all merged together within cardiology is just fabulous to see.
It's wonderful to see kind of all the cutting edge innovation and bring back ideas for practice. So it's just been a really great experience.
At the heart of the Science and Technology Hall is the Heart Hub. This is where you can find resources and educational opportunities, including the heart theaters, poster areas, and the Health and Innovation Pavilion.
It's so inspiring, especially as a medical student who's just getting introduced to this world. I'm just dazzled by the amount of technology and innovation and artificial intelligence, and the main sessions they're talking about it. They're grappling with these really difficult issues.
In the Learning Studio, Saturday sessions included a deep dive into the new American Heart Association Cardiovascular Kidney Metabolic Health Initiative and the commitment to improving outcomes for CKM patients.
We talked about some of the challenges we face as clinicians when managing patients with these complex but importantly related conditions. And we also talked about deploying therapies that are appropriate based on the risk these patients have, but importantly also keeping an eye on equity, because we also just learned how much of disparities exist in access to therapies in this space.
Also in the Heart Hub, you can find the next generation of AHA leaders with the HBCU Showcase and the AHA Scholars Poster Showcase.
My research is focusing on a protein called the sigma-1 receptor protein, and we want to see its roles in cholesterol metabolism and regulating macrophage inflammation.
The American Heart Association has a fantastic program set up for them for these 3 days, and they are able to really immerse themselves in science and learn about how to make the world a healthier place.
It's great being here. I'm glad that they've given us the space and the funding and the means to do all this and show off all the work we did.
In the Science and Technology Hall, LPA testing is back this year with support from Novartis Pharmaceuticals Corporation. And if your phone is running low on juice, be sure to stop by the Charging Lounge. Rounding out Saturday, a session which is a true fellowship of the ring. In this main event session, experts from electrophysiology, heart failure, and prevention came together to discuss and debate the latest science, guidelines, and controversies in the care of patients with atrial fibrillation and heart failure. This journey through the new Middle Earth included rate versus rhythm control, GLP-1 agonists, quadruple therapy, and catheter ablation.
I think this one offered a good debate, where other sessions I'd been to, most of the panelists were in the same page and had kind of the same advice. This had some differing advice or maybe different approaches of how they would tackle the same problem, which was unique and interesting.
Mostly I get the heart failure side of it, and we get like some interaction with the EP side of it, but like bringing them together and kind of having a little tension between them, where the EP doctors were just like, let's do it, everyone gets an ablation. And the heart failure doctors and the preventive cardiologists are kind of like, yeah, maybe let's slow down, let's check it out a little bit. So it was good to see the balance between them.
Saturday was full of education and excitement, and there's still plenty to come here at Scientific Sessions 2024. For now, be sure to follow us on social media and download the AHA conference app. I'm Dave Huddleston for AHAtv, supported by Novo Nordisk.
Patients are more than their disease. That's why for over 100 years, Novo Nordisk has focused on treatments to defeat chronic and rare diseases and help everyone meet their moment. Your disease doesn't define you, so what will? Novo Nordisk, driving change.